Welcome back. My next guest is Dr. Ryan Donegan, whose specialty is shoulder and elbow. He's an orthopedic surgeon, and I mentioned causes of shoulder pain. There's a bunch of them in there.
Yeah, definitely. I think I see a lot of patients that come through our office, so it's a much more common condition. Shoulder pain actually affects up to 15 to 20% of people at some point in their life, to the point where they actually would present to an orthopedic surgeon. So it's about 1 in 5 people, so quite a few. And so things that I hear from patients that are things that sort of dispelling myths is that most people think that shoulder pain or shoulder conditions are usually part of some sort of traumatic event, like a fall or a sports injury, and actually the vast majority are things that are more degenerative type conditions. So
now you mentioned degenerative. That means like arthritis?
Frequently I also see rotator cuff tears, which make up about 60-70% of my practice, but arthritis is a very common cause of shoulder pain that I see.
Well, now, when people talk about arthritis, they talk about hips and knees, but a lot of people don't mention the shoulder.
Yeah.
How do you know if you've got arthritis of the shoulder?
I think it can be, in some ways, a little bit hard by history to diagnose. People come in, they complain of some of the typical things I hear with most common shoulder conditions, like difficulty sleeping, some trouble with range of motion, some weakness, those sorts of things. Really, sleeping is actually the most common thing I hear from people. When they lay down at night, they say they just have trouble resting. But the real hallmark of shoulder arthritis is a catching or locking sensation in the shoulder. Patients go to move their arm and they'll actually feel things catch, and that's when they really become concerned and present to me.
So when do they need to come see you? How do they know?
I just think when people feel disabled by that pain. So oftentimes patients can sort of grin and bear this for a long period of time. They'll come in, they'll tell me, Doc, I've been dealing with this for 4, 5, 10 years. I've just been sort of tolerating it, taking maybe an occasional Tylenol, and they do okay, and they limp along, and then they come and see me when the pain gets bad enough that it's affecting their quality of life pretty significantly.
So you do arthritis, X-ray shows arthritis, and what do you do about it?
Yeah, so there's a lot of different imaging modalities. I think one of the beauties of orthopedics is that we're always, from a technology standpoint, trying to push the envelope a little bit. And so X-rays are the most simple imaging modality, and oftentimes can diagnose things like arthritis pretty regularly. But some of the early signs of arthritis where you would not see it in an X-ray, you need to use advanced imaging like an MRI or a CT scan to really diagnose it accurately.
So what do you do about it?
Yeah, I think when we treat these, it's all about symptoms. So I think one of the misnomers about going to see the orthopedic surgeon is that I'm going to end up with surgery, right? In reality, at least in my clinic, anecdotally, I would say probably 1 in 8 to 1 in 10 patients actually require surgery. And for this condition, such as arthritis, it's probably only about, similarly, 1 in 8 to 1 in 10. And so a lot of patients are treated non-surgically. Things like injections, physical therapy, those actually go a long way, and even simple anti-inflammatories can really take the edge off to where patients can tolerate it.
But if they do have surgery, just like we have knee and hip replacements, you do shoulder replacements also?
We do. Actually, right now it's the fastest growing, percentage-wise, the fastest growing type of replacement that we're doing in orthopedics. So everybody hears about knee and hip replacements, and they've been the mainstay of replacements for decades, but technology has come a long way over the last probably 20 to 30 years, where the implants we're using now are performing better, lasting longer, giving patients a better quality of life.
Now you say lasting longer. How long does a shoulder last?
That's a question I get pretty much every time I talk to someone about a shoulder replacement. They say, how long is this going to last, Doc? And I tell patients usually the failure rate is about 1% per year. So ultimately about 80% of people at 20 years will still have that same replacement in place. And so really good odds of having pretty significant longevity with the current designs we're using.
What's the recovery time?
It varies. There's actually 2 different kinds of shoulder replacements. One's for a reverse total shoulder replacement we use with patients who actually don't have a functioning rotator cuff. That's a little bit more of a rapid recovery, just a few weeks in a sling, return to most of your activities by about 8 to 10 weeks, with full recovery at about 3 to 4 months. With a regular, or what we call an anatomic shoulder replacement, where really you need to have the muscles supporting the shoulder to be functioning very well, I go a little bit longer. It's usually about 4 to 6 weeks in a sling. We do a little bit more physical therapy with return to full activities, or getting to that plateau at about 6 months.
Okay. Who's at risk for shoulder arthritis?
Yeah. Everybody would think it's sort of the individuals who are very, do labor-intensive jobs or play sports for years. It's actually just individuals who get a little bit further along in their years. You know, I see most patients who have shoulder arthritis end up being about 55 plus.
Well, that's about right.
Well, no judgment here. No judgment here. And so it's oftentimes this sort of slow process that happens over a very long period of time, and it's not necessarily the individual that's been hanging sheetrock for 20 or 30 years or played college baseball or professional baseball for 15 or 20 years. And so it tends to be the average run-of-the-mill individual who just over time their cartilage decided to, to peter out a little bit. So
we appreciate what you do and appreciate you coming in and telling us about it.
Thank you very much.
Right. And if you have shoulder pain, Dr. Donegan can help. We'll be right back.